Good morning, everybody. Welcome. It's Laura here from the Devonalliance. I'm here today with Hannah. Hi, Hannah.
Hello. Hi.
Hannah's an OSCE trainer, and your company is called Nurse Tutoring with Hannah.
Yeah, that's right. Yes.
Nice. Nice to meet you, Hannah. And also Kerry Strazanti from the Devonalliance. Hi, Kerry.
Hello.
Thank you for joining us today. So we're going to be talking to Hannah about some OSCE updates. So tell us what's been happening.
Yeah, so just a new update which came out a couple of weeks ago on the NMC website. So you always have to just go on there and have a regular look, especially if your OSCE is coming up soon, because they just put the announcements out without kind of like any kind of notification. So I was doing my weekly check and they've put up a new announcement around subcutaneous injection of insulin and how they're moving or have moved over to using insulin pens instead of drawing up from the vial with an insulin syringe. So this is quite a significant change, I suppose, and it's for adult and child OSCE, so for both of those branches. And insulin pens are definitely been welcomed, I think, by the educators because it's more in line with current practice. It's obviously kind of a safer way of administering insulin and a easier way as well. So lots of patients will be managing their diabetes with their insulin pens. So I have got my insulin pen, so I could show you that if it comes up on the camera.
Yeah.
So the other question I've been getting a lot about the insulin pens is, are they changing the marking criteria? Why isn't the marking criteria changed? And we have, as educators, contacted the test centres, and the marking criteria is staying as it is. And that is because you may be in a situation where you're giving, yes, insulin via an insulin pen, but also other subcutaneous injections, maybe things like anticoagulation or Clexane, in which case, the marking criteria is to cover both, if that makes sense. So there's not going to be specific changes to the marking criteria, but the test centres are expecting candidates to deliver insulin with a pen following best practice guidelines. So this is where it's so important when you're preparing for your OSCE that you understand those best practice guidelines and follow them, and not just that rote learning memorization of the marking criteria, because that is not going to work specifically for the insulin pen because they have not produced that type of marking criteria. Does that make sense?
Yep, complete sense.
And so, any training that you're going to or any trainers, make sure you're being shown kind of both techniques as well. I don't know how clear this will be. So this is a training insulin pen. So insulin pens are brilliant, so straightforward. In terms of your OSCE, you'll have something similar like this. There is a new picture of it on the equipment test list. So it's got a cover, and then your practice insulin will be in this vial dose here, and that's where you check and confirm that insulin matches your prescription and the expiry date. It's got the end where we will attach our needle, and then it's got the dial where we dial up the units of insulin, and then our button which we press, which delivers the insulin. So they're quite straightforward. They do reduce risk because it's much more difficult to obviously draw up a wrong dose and things like that with the syringe. So you need to get your insulin pen and your insulin needle. So we always put a new insulin needle on every time we administer the insulin. If you've got a cloudy mixed insulin, guidance is that you just roll it 10 times just to, you don't want to be shaking the insulin. We just give it some rolls. Obviously, everything else for the station stays the same. So remember, you still need to do your ID checks, your allergy checks. You still need to explain to the patient the procedure and gain consent. You still need to be checking things such as your blood glucose level. You still need to be assessing and rotating the skin site. We still need to read the prescription and confirm it's valid. So all those same principles apply, and it's just the preparation and drawing up of the insulin which is changed. So we just want to take our little cap off. So there'll be a bit of paper or some foil, and then this screws on to the end of our insulin pen. And then there's a outer cap and a little inner cap over the needle. So you've got to be careful with this because obviously it's a sharp, but you don't want to be sharpening ourselves in the exam. It's really important to prime your pen, okay? So this is when we talk about best practice. And if you looked at the marking criteria, it's not going to say you need to prime the insulin pen. Priming gets rid of any air within the system. So when we dial up the correct dose, we're giving the correct amount of insulin, and we're not giving 4 units of insulin and 2 units of air, for example. So to prime your insulin pen, you need to turn your dial to about 2 units. Now mine is very primed and there's insulin's going to go everywhere when I do this, but just to show you, hold it up vertically, and I'm going to press the bottom of the pen, and you'll see just that little bubble of insulin coming out the top. And as soon as that insulin comes out the top, I know all the air is taken out of that system. And when I set my dose, I'm going to be giving the right dose. So priming is really important, and it's not something that is going to be on the marking criteria unless they decide to specifically update it in relation to pens, which they're saying at the minute they're not going to.
Right.
You then obviously need to dial in your prescribed dose, so 6 units, 8 units. And when we administer the insulin pen, we want to obviously make sure we're changing the site. So common sites are the stomach, or top of the thigh, or the soft part of the back of the arm. And we've already checked to make sure that site is clean and it's safe to administer in there. We're still administering at a 90-degree angle, okay, for insulin pens. You can gently pinch the skin, but you don't need to as much for the pen because the needle is much smaller, but you can gently pinch the skin in at 90 degrees, and then you will just press the button and that will administer the insulin in, and it is done. You then should wait 10 seconds. And again, this is a really important part of your pen administration, which again is not on the marking criteria. So we should wait and count 10 seconds before we release the pen and release the pinch. Now, you need to also always be careful with your safe sharp management. Now, the NMC have a no recapping, no resheathing policy, otherwise it's a critical fail. You can just gently unscrew this and put this straight into your sharps bin. Yeah. However, some of my nursing students that have been up last week have been told that they are able to put this outer cap, it's a bit blurry, sorry, back onto the insulin pen. Yeah. And dispose of it that way. So just obviously listen to your examiner, but just make sure all your sharps go directly into your sharps bin.
Yeah.
And then you have finished using your insulin pen, so just make sure you store it back correctly. You can put the outer plastic cap back on it and finish your station as you normally would.
Oh, that's really interesting. Thank you. Yeah. Have you found that nurses that you've been training have welcomed the change?
Yeah, they have actually, because a lot of nurses are already familiar with insulin pens and it's something that they're used to in their practice. So it's definitely, I think, a lot easier than trying to draw up units on the syringe. I find that anyway because of my eyesight now anyway. But it's definitely like easier, and the whole thing, they're more familiar with them, so it's been welcomed. And it's gone into adult and child. And had a child nurse who sat last week, and she had the insulin pen as well, so it's in and in place, so expect it to be in. It's not something that's coming in a few months. They are in and using it.
It's there, it's been implemented already. That's so interesting. Thank you so much for that, Hannah. Okay. Let's talk about nursing in the UK at the moment and what's happening. So we, as you know, recruit international nurses for trusts throughout the UK. And I know that you have a lot of people that self-sponsor for their OSCE. So what are you finding at the moment with people that are self-sponsoring? What are they sort of saying to you?
Like the general, I think there's 2 camps. There's nurses who are holding out till April, where they feel there might be some announcements and changes, and that would be a nice thing to discuss with you, Laura, if you know about that and whether that's going to come in. There's nurses who are obviously wanting to self-sponsor and go through that route, so they are, pin ready when potentially recruitment, increases or jobs become available. I'm really honest with them at the moment, because it's not, there isn't a lot of jobs available at the moment, is there? And that big mass recruitment that we saw, last year and, the 18 months leading up to that is not present, is it? And it's unlikely, I feel unlikely to come back to that scale of level and funding. Yeah. So it's a difficult position, isn't it? So, without self-sponsoring and getting their pin, they're never going to be in a position to get a job in the UK, are they? So it's, but then
there's
at
still
the moment,
no
is it like they need to, sorry?
There's still no guarantee at the end of it, is there?
No, but then without it, there's never going to be that opportunity, is there? So it's very difficult, but they need to, think about it in terms of, financially, the financial cost of self sponsoring, that money's not going to come back.
No.
And are there other countries, actively recruiting, and just compare those really and what they want to achieve, I think.
Yeah, we have the same. We have the ones that are trying to hold out and have been waiting really patiently and eagerly, and the ones that, are trying to self-sponsor and get here. We're honest with them as well. It's entirely up to them, but there is no guarantee, but it's entirely up to them. And you can understand why they're trying to do that as well.
What would you say, Kerry, if someone said to you that they would like to take the OSCE self-sponsor route?
I say it's entirely up to you which route you choose. But I do need to let you know, obviously they don't get the whole package that they'd get with us if there's job opportunities. They don't get the training, the money back, the support throughout. So let them know all of that, and also that there is no job guarantee at the end of it. But obviously we wish them all well, and it's up to their own free choice. Yeah, and that's all we can really say at the minute. Just try and be as honest and supportive as possible.
Yeah, I would also want to make people aware that a lot of NHS trusts are, if they're hiring a nurse with a PIN, they would also expect for that nurse to have NHS experience behind them as well. So that's also another barrier that they would face. If they self-sponsor their OSCE, you're not going to have the guarantee that the hospital will give you that money back. And at the same time, they will want you to have NHS experience. So you just need to be aware of that fact as well. So there's kind of two camps at the moment, but we know that the whole volume for general medical surgical nurses isn't going to be as it used to be. As and when it does sort of pick up, it will be for smaller cohorts for more specific roles. So your surgeries, your midwives as well, orthopedic nurses. So I would heavily sort of recommend that people diversify in their specialty, and they look for other areas that they could specialize in that are more specific, to build that up on their CV, to get a year or 2 years experience working in a theatre, working as a pediatric nurse, or working in a specific area like endoscopy or orthopedics, so that you're showing on your CV that you've diversified into a different role rather than having that general medical surgical. Because I think that as we go in, and yes, they may be needed, but it is going to be more specific roles that they're looking for. And it's more trickles at the moment. The floodgates aren't open as they used to be, but it's more of a trickle. So we've diversified ourselves into other areas, sort of allied health professionals, so ODPs, operation theatre, they're practitioners, aren't they, rather than the nurses, and radiographers, as have been requested by the hospitals. But as we say, there's not going to be that volume recruitment in the future. So we would encourage people to apply on our website, even if you've got your PIN. Once you've applied, we've got your details then, and we can look. If somebody says we need to have 10 theatre nurses, we can look through our CVs, we can look at the nurses that we've got in our pipeline, and we can say these are 10 really good nurses that we would suggest that you interview. So even if you've got your PIN, we would definitely encourage for you to apply with us. For the hospitals, it's not the cost of the training that's the issue, it's the cost of the sponsorship, and everything that comes with that. So yeah, when it starts again in the future, it'll be smaller cohorts.
I think
I agree.
Yeah, I think it's really important about diversifying your practice base as well. Obviously, a lot of internationals come with the medical surgical nursing background, but when you're looking to apply for jobs, and even if you haven't got that UK nursing experience, if you've got tangible examples of your practice which can be transferred, over into the job that you're applying for, that is so important. When I do interview preparation, I'm all about like finding out what these nurses do at home. Like, I don't really have any concept really of what nursing is like in India or Nigeria, if I'm really honest. So I'm always like, tell me about it. What's your patient ratio? What are these patients coming in with? What are you doing on a shift to shift basis? Draw out all that knowledge and experience that you've got, and show how that is transferable over into an NHS setting where you've got 32 surgical patients in a ward, or things like that. How does it equal out? Because actually they have got a huge amount of experience, and I've worked under very pressurized areas with, you know, all the same problems, you know, that we have as well. But it's you know, using that experience and applying it and showing your interviewers, or even on your CV, you know, the experience and knowledge that you've drawn with it. Definitely.
Yeah, that's such good advice. It's very true, isn't it?
Totally
Yeah,
agree.
definitely. Yeah. And
any information that you can put on there can strengthen your CV, you know, anything like that about diversifying rather than generic. That's definitely a good point. Yeah.
And what do you, Laura, have you got advice for people who are going, maybe it's another webinar around ethical recruitment, and people, because when people are not desperate, but when the opportunities are not as, you know, forthcoming as they have been, people look at all different businesses and routes, won't they, to try and, you know, fulfill their dream. What are the key things that people should be looking out for in terms of going with private recruiters, do you think?
It's so difficult. I think you'd need to kind of do your research into said private recruiters. So do they actually have connections at the hospital that they're talking about? No money should exchange hands between the candidate and the recruitment company. So the recruitment company will get their fee from the hospital that they are working with, or the organisation that they are working with. So as a candidate, if you're asked to pay any money with regards to the recruitment, then that's not right. You know, some companies will say that, you know, they would ask you to pay your flight and potential costs that could be incurred. They can't claim the cost of the sponsorship, which has gone up to, I think it's £527 now for a certificate of sponsorship, a COS. So they'll never be asked to pay that, but they might say, you know, you will need to pay for your flight, and that's acceptable. But to pass down a cost of thousands and thousands of pounds isn't right, and it isn't ethical. And if anybody finds themselves in that situation and they don't know what to do, please reach out to us. I'd be happily to look into a company for somebody if that means that somebody's not going to be scammed out of any money. But I would just recommend applying directly onto NHS jobs, onto Track. Reach out to people like us, the Devonalliance for International Recruitment. If you've got friends that are in the UK and are happy with their recruitment, ask them the path that they went down. Keep looking on LinkedIn, so social media. So LinkedIn is the best for jobs because it's professionals. You know, through Facebook and things like that, I do find that people are easily scammed through Facebook and Instagram. There's less checking for reputable companies on those types of areas, so keep it to a professional search like LinkedIn, and just do your due diligence. If it doesn't sound right, if it sounds too good, then it probably is. So yeah, just look into it, reach out to us if you need any help, but please don't be taken in by people saying that they've got hundreds of jobs, because that's just not the truth at the moment. Yeah, it's so sad, isn't it? But please reach out if you're in that position where you're feeling that you're not sure. You know, we're happy to talk to anybody to look into that for you. Yeah, it's so sad, isn't it? But please don't be taken in by those types of people, because it's just not. It's horrible, and people are being scammed out of thousands of pounds, and there's nothing at the end of it as well. So
it's heartbreaking, really. You want to make sure that they go with somebody trusted and that they can, of course, get a job at the end of it. So yeah. Have you got anything else that you want to add, Kerry? No, I think we've covered it, really. If anybody has any queries or questions, like Laura said, you can always email us or reach out, and we'll do our best to help, because it is a lot to cover, isn't it? And there's, you know, but yeah, great advice, ladies.
I will just add on to that, just to say that I know that Hannah said in the beginning that people are holding out to April to see what happens. And I would say last year I thought that something would happen in April, and it didn't. So we would just say we're hopeful, but we haven't got any insider information. We've not been told anything. So we're hopeful in the next few months, maybe by the summer, but we really don't know. So we don't have any extra insider information. As soon as we hear, we will put on our social media pages, the Devonalliance, but we don't have any updates at the moment, and we don't know what the truth is with regards to April. Yeah.
Yeah, I think that's really important to say, isn't it? Definitely. Just help people their decision making, isn't it? And
yeah, we don't know if it will be April, but our biggest advice is to diversify, like we already said earlier, diversify your CV and get into other areas, because it isn't going to be generic anymore. It's going to be very specific recruitment and smaller numbers as well. Yeah. Thank you so much for talking to us about the new insulin pen station, Hannah. That was really insightful. And I'll pop Hannah's details below if anyone wants to get in touch with Hannah about OSCE training. Hannah's business is Nurse Tutoring with Hannah, but I'll put her website below and all of her social media pages, but you can find her through Google as well. So thank you for your time today, Hannah. It's always lovely to catch up. And thank you, Kerry. We'll see you soon.
Yeah, nice to see
Thanks,
you.
guys. Take care.
Bye.
Thank